Hey, you're back from the doc. So what did she say?
Yeah, listen, thank you so much for covering my desk for me this morning.
That's okay. So, what did she say?
Well, she got my results back and says that I have rheumatoid arthritis. She gave me a bunch of stuff to read, and I have to go see a specialist on Tuesday to talk about medicine. I'm kind of upset. I mean, it sounds serious. I don't know if this is going to affect my plan to go back to school or if I can even think about that now.
Gosh, I didn't know it was giving you that much trouble.
Well, around here, not so much, but at home, it's been giving me more trouble. I mean, when it got too difficult to even do my knitting, I went to get checked.
Oh, yeah, I noticed you hadn't been bringing it on breaks.
Yeah.
But arthritis? I thought that just older people got that. Don't they just give you like aspirins or creams for that?
No, I get the impression it's not that kind of arthritis. She called it rheumatoid arthritis. I don't even know what that is. I guess I'll have to read all this stuff.
Well, maybe you can find some stuff online.
Yeah, she said there was some good websites and some not so good websites. So maybe I'll do that instead.
Oh, ooh, time to get back. We'll talk more later?
Oh, yes, I'll see you on break. And listen, thanks again. Okay. This is Layla. How can I help you? Yes, I'll put you right through.
Rheumatoid arthritis, or RA, is a condition that causes swelling and pain in joints. It's different from other kinds of arthritis. It's a lifelong condition. RA causes inflammation, swelling, redness, and pain, and it can damage the joints. Every person has an immune system to be able to fight infections such as bacteria or viruses. In RA, the body's immune system begins to attack its own joints and can sometimes attack other parts of the body. No one knows exactly why. RA can begin in any joint, but can eventually affect all of them: wrists, hands, knees, ankles, shoulders, leading to stiff, swollen, or painful joints. The lining inside of the joint is called synovium. In RA, the synovium becomes inflamed and swollen, causing pain and stiffness. There is no cure for RA, but the drugs discussed in this program can slow down the disease and help you feel better. If left untreated, RA will get worse. In fact, without treatment, the inflammation will continue to damage and eventually destroy the joints, organs, and other parts of the body. Occasionally, the inflammation can affect other organs, such as the eyes or lungs. Any organ can suffer. And RA can even cause disability, such as difficulty using your hands or problems standing and walking. RA is a serious condition. It requires treatment and monitoring by a doctor to prevent additional problems.
Hey, how's it going?
I am really glad to see you.
Why? What's going on?
I started reading all this stuff, and there's really a lot to decide.
Oh my, like what?
Well, a lot of it has to do with the drugs they use to treat this. Just look at this.
Wow, I see what you mean. I mean, it's nice they summed it up like this, but it is a pretty long list.
Yeah, I'm not even sure what I'm supposed to know about all these drugs.
Medicines are the main treatment for RA. They relieve pain and reduce the swelling in joints. Most people with RA need to keep taking their medicines for life. This guide talks about two kinds of RA medicines: DMARDs and steroids. DMARD stands for disease-modifying anti-rheumatic drugs. These medicines relieve inflammation and pain, and they also slow or sometimes stop the changes in your joints. There are many different DMARD drugs. Some are in pill form, some are injections or shots, and others are given intravenously or IV through a needle in your vein. There are at least 10 different DMARDs. They each have a generic name and one or more different brand names. You can find a list of all of the current ones in your guide. One of the standard DMARDs that's often used is called methotrexate. It's a pill, and for many people it works as well as other DMARDs that are given by shot or intravenously or IV. Most of the DMARDs that are given either as injection or by IV are a newer class of drugs that are also sometimes called biologic DMARDs because they have a different way of acting than standard DMARDs like methotrexate. Sometimes doctors will prescribe a combination of medicines, one or more standard DMARDs, or a combination containing a standard and a biologic DMARD. The other drugs we use are called steroids, drugs like prednisone or prednisolone. These are man-made forms of hormones that your own adrenal glands make. These drugs help with joint pain and swelling, and there is some evidence that, like DMARDs, they may slow down the damage to your joints. Your main treatment will be one or more of the DMARDs and steroids as needed when recommended by your doctor. Finally, your doctor may also prescribe a non-steroidal anti-inflammatory drug, an NSAID, like ibuprofen or naproxen, to help with the pain and inflammation. For many patients with rheumatoid arthritis, it may take some time to find the best combination of medicines. If one medicine or combination of medicines isn't working well, your doctor may switch you to other drugs or add more medications to the mix in order to achieve the best relief. Your doctor will work with you over time to find the drug or combination of drugs that works best for you.
Well, why do I need to know all that? I mean, won't the specialist just give me a prescription for the best one?
Well, you'd think so, but I'm reading here, and it seems there's a bunch of things that goes into deciding which medicine to take.
Yeah, and a lot of questions I have. I mean, first off, do I need a shot or can I take a pill? When do they start working? What if they stop working? And what about the steroid thing? Aren't those like banned or illegal?
The sports ones?
Yeah. Oh, maybe I'll get all athletic.
Yeah, those are questions you better ask. And wow, look at the differences in cost. I wonder what's up there. I mean, what's the difference between the $6 one and the $1,500 one?
Yeah, I think some of them are just pills and some are shots. Which, by the way, who gives the shots?
I wonder, too, how long you need to take these medicines.
Yeah, a lot of questions.
Better make a list.
Oh, speaking of lists, what about Anna's baby shower?
Oh, I need to get on that. Thank you for reminding me.
It was about 4 years ago when I got my first symptoms of RA. I started feeling like every joint in my body was sore. I mean, I couldn't even walk because of the pain. It was almost impossible to walk downstairs most mornings, and leaving my house for the day was a nightmare. When I saw my family doctor about all this pain, she really didn't know what it was. I took some pain pills, but they didn't help much, and I felt like my body really started to swell up. My doc told me that I should see a rheumatologist, one of those docs that specialize in joints, and she prescribed some medication called methotrexate. I was doing okay with the methotrexate. My doctor told me to take 6 pills that I took all at one time, once a week, and he also gave me some other pills called prednisone. After about a year, this medication just wasn't doing the trick, so my doctor upped the methotrexate to 10 pills a week. I also needed to get blood tests to be done with the treatment to make sure that my body was adjusting and handling the meds okay. I took methotrexate for 2 years with no side effects. After that, I started to have liver problems, and my doctor thought that maybe it was caused by the pills, so he put me on 4 pills only. But even then, I still continued to have liver problems. Then my doctor recommended an injection he called anti-TNF, which is a biologic therapy. I'm always scared to start taking a new drug, especially when it's a shot, so I was a little nervous about it, especially because I needed to inject myself. The doctor then explained to me how to do it. I also wondered if there was anyone out there who had had some good results while they were on the shots and without too many side effects. He said there were many other patients who were using these injections and were happy with their improvement. I'm thankful that I have a doctor who is willing to go over my concerns and all my questions. The injections have done wonders for my pain and the severe joint inflammation that I had. But these meds have to be taken very seriously, so I continue to get blood checks to make sure everything is fine.
Remember, there are 2 main types of medications for RA, DMARDs and steroids. However, taking other medications may be needed to feel better. One of the DMARDs will be your main treatment. All of the DMARD drugs work, and they can slow down the disease and relieve pain. But it's hard to predict which drug will work best for any one person. About 65 out of 100 people need to change their RA drug at some point, either because it isn't working well enough or because of side effects. Given the many DMARDs available to treat RA, there are some factors that might influence the choice that you and your doctor make. One factor is how the medicine is taken. Some DMARDs are pills, and pills are certainly easier to take than those that have to be injected for most people. Some of the pill forms have to be taken every day. Others are taken once a week. Cost is another factor, and for the most part, the pill forms are less expensive. Most people can start with a pill, but if that isn't working, the doctor may change to a DMARD that's given by injection or shot. Most people give the injections to themselves at home. Some of the DMARD shots are only needed once or twice a week, and still others are only needed once every 2 weeks. Other DMARDs, like abatacept, infliximab, and rituximab, are given intravenously, or IV. That's an infusion that goes into a vein. This is a treatment that you get at a clinic or your doctor's office, but most people only need to have it once every few weeks. DMARDs do not start working right away. It may take weeks or months to start working, so you may need other medications like steroids or pain medicines in the meantime. The steroids that are used are not the same ones as you hear about athletes misusing. Remember that steroids may slow down the damage to your joints that is seen in x-rays, and they may help to alleviate the symptoms. But they can have side effects if they're used for a long time, so your doctor will probably try to use them sparingly only when you need them. All of these medicines can help you, but they are powerful, so you'll need to be careful about certain things. One of those things is infections. Remember that RA is caused by your immune system attacking your own tissues. So all of the drugs we use are designed to suppress your immune system to make it less active. But since your immune system also protects you by fighting infections, drugs that suppress it can put you at higher risk of infection. In other words, it'll be easier for you to get infections when you're taking these medicines. This means you'll need to be more careful about staying away from people who have colds and flu, because you will be more likely to catch what they have. Your doctor will probably want you to get flu shots, but don't get any other vaccines without asking your doctor. You'll also need to pay closer attention to wounds or sores, things that might normally heal, to make sure they don't get infected. And if you do have a sore or wound that isn't healing, or you get an infection, let your doctor know right away. Finally, many of these medicines can cause birth defects. So both men and women who take them should use not just one, but 2 forms of birth control, a condom and a birth control pill, for example, to prevent a pregnancy. This is something you and your partner should talk with the doctor about. Because RA medicines are powerful, they also have the potential for unwanted side effects, and some of these can be serious. Be sure to read the drug information that the pharmacist gives you so you can be alert to any unwanted reactions and report them to your doctor.
Doctor, I have some questions about my medication.
Good. Let's talk about it.
Well, I brought a list, but I did want to ask about how I should.
It's very important that you see your doctor regularly and discuss all of your questions with him or her. Your medications will probably need to be adjusted over time. But even if they seem to be working well for you, your doctor still needs to see you to make sure your medications aren't harming your liver or kidneys and that your blood cell counts are okay. So it's important to keep all of your regular doctor and clinic appointments. The goal is to help you feel better, to be able to do all the things you want to do, and to prevent further damage from happening.
My doctor prescribed methotrexate by itself for 1 year, and he told me that I needed to have blood work done every 6 weeks just in case something different showed up in the tests. I took the methotrexate for several months, but continued to have this overall feeling of being more exhausted than normal. In the morning, I felt like I was stuck in cement when I woke up, and it was very painful to move my arms and legs. My doctor recommended adding another DMARD. He said that some come in the form of pills and others, the biologics, are injections. As for the injections, he mentioned that some are self-injected and those go in the skin, and other injections could be done in his office, but those go in the vein. He also said that maybe I could go to the office and have them show me how to inject myself a few times until I got comfortable with it. He even gave me some suggestions for taking the shot without feeling so much pain. After asking him some questions and going over all the advantages and disadvantages of the DMARDs, my doctor and I decided that the injections could be held for later if I needed them. Because every time I think of needles, I start to panic, and well, I'm scared of needles. So my doctor added another DMARD pill. I know that now I have to take a bunch of pills every day, but at this point, I do not want to go through the injections, and my doctor understands and supports my decision. I started the new DMARD, and it took a few months until I felt better. My doctor explained that DMARDs do not act overnight, and it would take a while until I would start to see some changes for the better. I'm also on 5 milligrams of prednisone a day and on an anti-inflammatory for pain. I feel so much better now. It's just a matter of time waiting until the pills started to have an effect on me. I've heard from other folks with RA that these medications affect people in different ways. I guess it depends on how sensitive your body is. I understand that they don't work overnight and that they have to build up in your body, but eventually they work for me.
Hey, you're here. Seems like a long time.
Well, almost a month. That's what we get for taking our vacations back to back. Hey, I got some new coffee creamer. Give it a try.
Well, look at this. So you're back to doing your knitting. Haven't seen that in seems like forever.
I am.
This is nice.
Right?
Wow, doesn't seem that long ago. I was thinking you might not be able to do that anymore. Once I realized things were pretty serious, I stopped bringing my needlework on break so you wouldn't feel bad.
That is so sweet. I noticed you didn't, but I didn't know why.
Yeah, well, it turns out there's a lot to this.
Well, you'd be right about that, and I'm still adjusting.
You've been in treatment a while now.
Well, I've been on the medicine for 4 months now.
Wow, doesn't seem that long. So how much longer do you have to take it?
Well, for the rest of my life. Yeah, this really doesn't go away. And if you don't take the medicine, it gets worse and it can just wreck your joints. But the good news is the DMARD drugs actually slow that down. You know, kind of keep it at bay sort of thing.
Well, that's a good thing.
Yeah.
And what you call them again? DMARDs? Which ones are they again?
Those are the ones that aren't just pain relievers. They actually slow down the damage. And DMARD stands for Disease Modifying Anti-Rheumatic Drugs, which is a mouthful.
Yes, it is. DMARDs works for me, and I guess it works for you too.
Yeah, and the fact that there's a bunch of the DMARD drugs to choose from means that, you know, if mine's not working, she can switch it out, do a combination, just, you know, manage it.
I see. So what else do you have to do treatment-wise?
Well, I have to be a lot more careful about not getting cold or flu bugs. So if you have anything, I'm not coming around. And I have to be extra careful not to get pregnant on these. But at my age, that really shouldn't be a problem for too much longer, hopefully.
Oh. Wait, what about school? That's still on?
Yeah, I'm all set for the fall. I just heard yesterday. I'm in.
Oh, that's great.
Yeah. I'm just really glad there's treatment for this, something to stop the pain and maybe slow it down. You know, now I'm back to my knitting.
And that's the stuff. I'll start bringing mine again.
Yes.
I was diagnosed with RA 6 months ago at the ER after waking up with unbearable pain one morning. I didn't know what was wrong. The ER doctor said I had rheumatoid arthritis and have most likely had it for a few years now. I used to feel quite sore all over my joints, wrists, hands, shoulders, feet, and sometimes my knees, especially in the mornings and after working in my garden for a while. I would take a painkiller and the pain would go away after a while, but then it would come back. The ER doctor said I needed to follow up with a rheumatologist to start a treatment plan. I finally got in to see a rheumatologist. She explained that rheumatoid arthritis is a disease that affects the joints. It's a lifelong disease, and if it goes untreated, it can cause lots of damage to the joints and can even cause deformation. The rheumatologist said there are different kinds of rheumatoid arthritis medications, and each has its own benefits and risks. She explained that DMARDs are one type of medication that helps to get rid of the pain, but also helps slow down the disease. She said we would try a DMARD medication called methotrexate first. The doctor also said it will take a while to work, and she gave me a steroid to take with the methotrexate in the meantime. The steroid is for a more immediate relief. She said that since I was having a lot of pain, I should take the steroid daily, and then once the methotrexate started working, we could see about decreasing or even not needing to take the steroid. The doctor also said I could continue the pain medication I was given at the ER as needed. Well, just after 2 months of taking methotrexate, I was able to get out of bed in the morning without much pain. I even made breakfast for my family one morning. It's been 6 months and I have not needed the steroid for quite some time. Now I only take methotrexate. My doctor also suggested staying active and eating right, no junk food. She also said I need to continue to follow up with her regularly to make sure I'm not having any problems from the medications and my rheumatoid arthritis is under control to prevent any painful flare-ups. I have rheumatoid arthritis, but since my doctor and I have been working together and keeping it under control, I have felt absolutely terrific. Now that I feel better and in more control, I have also asked my doctor about other non-medication treatments that can be useful for rheumatoid arthritis. My doctor explained that exercise can help people with rheumatoid arthritis experience less pain and depression and can have less disabling effects. I know that if I start eating healthier and sleeping better, I can decrease my stress and learn new ways to cope. On top of that, my doctor said it's very important that I quit smoking. Smoking is bad for you in general, but doctors also think it's pretty bad for arthritis because it can increase the inflammation in your joints. Now I understand the importance of not missing my doctor's visits and why I need to keep my immune system strong, like keeping up with annual flu shots to avoid any future problems.